let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at the answers. And every now and then you get one of these questions where you're like, oh, beautiful. What an easy one. Quick answer and move on to the next one. These can be traps. And I wanted to just highlight this question here as a specific example. Now, the thing that's going to get you full marks for this one, and always remember, if there is just one response required, that response has probably got to be a good one. It's either going to be a very specific diagnosis, or as we have here, it's going to be an answer that requires multiple parts. So the most appropriate answer here would be urgent transfer via ambulance to emergency department for suspected Addison's disease or adrenal crisis, something in that kind of ballpark. The thing that gives this the full marks here is you're specifying that it's urgent is the number one criteria. You're specifying where, so emergency, and you're specifying why for suspected Addison's disease or adrenal disease. Now, you could put anaphylaxis here. You could put something completely random, but I think as long as you're specifying a reason why you're concerned, I think that's going to get you some extra mark. I mean, if you say for a bee sting, they're probably not going to give that to you. But I think if you're making some kind of sensible, logical leap into the realm of why you're concerned, tick, 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 tick. Now, this is one of those instances where it's easy to lose marks here, because if you were to just specify urgent transfer via ambulance to ED, you've already lost 1 mark there. If you were to say transfer via ambulance to ED for suspected Addison's disease, there's a chance you might lose a mark because you haven't specified urgent transfer. I mean, you could argue there is perhaps a little bit of time to wait for this one. The blood pressure's low, but it's not terrible. There are inherent risks in terms of paramedics driving lights and sirens to and from emergencies. But again, it's really showing that specificity in your answer. Likewise, referral to ED for suspected Addison's disease, you've lost that urgency criteria, and referral to ED 1 mark, because yes, you're doing the right thing, but it's not showing that consultant level knowledge of why and how you're doing it. So I'm going to be super picky here, and fantastic response here. Urgent referral to the local emergency department for glucocorticosteroids. You've specified urgent, you've specified ED, you've specified why. You've kind of jumped ahead even, and this is something exams do, so feel free to do it yourself. This is showing the person that's marking the exam, not only do you know what is wrong with this patient, you know what they need to do about it. So that's actually a fantastic answer there. Urgent transferred ED, again, correct, but lacking a little bit of the specificity that consultant level knowledge requires. And so just kind of fleshing that out and you've fallen for the trap, sorry. I'm glad you did, because this is one of the things I wanted to highlight with this question. Sorry to pick on you. All right. Of course, there's more parts to this question. So let's get 2 minutes on the clock, and your time starts now. All right, time is up, and let's have a look at the answers here. Is it JGC? Is it HJG? Is it CHJ? Guess what? You're all fantastic. This is one of those things that sometimes will freak you out if you're seeing other people putting different answers down. Often there are going to be more correct answers than what they're asking for, and this is one of those classic situations here. And so again, you've already picked the diagnosis here with your previous answers in regards to this is Addison's disease. How are we going to confirm that? We're going to get a adrenocorticotropic hormone. We're going to get a serum cortisol, and tying into that as well is going to be our serum glucose and urea and electrolytes. Best bang for buck with those marks there. Well done, guys. No more needed. Let's move on to the next part. 2 minutes on the clock, and your time starts now. Except it's a delay, so let's put 2 minutes on the clock and your time does. All right, time is up. Let's have a look at some of those answers. This is one of those questions that's going to potentially challenge some people if you're used to thinking more along the lines of just pharmacological management. Um, and if you get caught in some of these situations, ask yourself, what would you actually do if this patient's in front of you? Because that's what's going to be what this patient actually needs. So for here, of course, we're going to need urgent referral to an endocrinologist for ongoing management. And again, this is one of those kind of three-part responses. You're saying this is an urgent referral, as the patient needs to be seen pretty much immediately, who it's to, and what it's for as well. You can be as vague as saying ongoing management. You could continue resuscitation. You could say for management of Addison's disease, but specifying why you're doing something, again, is something that they really like to see as showing that consultant level knowledge. Now, some of the other non-pharmacological management things that are particularly important is to prepare your emergency or adrenal crisis management plans. These are things that save patients having to go to ED in the first place and is vitally important to do for any patient with Addison's disease or adrenal insufficiency. Now, this would be something that probably would be prepared in conjunction with their endocrinologist, but I think any GP worth their salt would also have a crack at putting something together to make sure the patient's as safe as possible. And if it's something that you haven't had much experience with before, there's actually some really, really good templates or kind of guidelines to follow on ETG. Tied into that as well is going to be preparing a sick day management plan. Now, this is different to an emergency management plan. Management plans when they're going to adrenal crisis. Sick day plans if they become unwell, if they're having an operation or procedure done, how are we going to address the additional corticosteroid requirements around these. Of course, we also have things like a medical alert bracelet, something to flag to those around them that if they do go into crisis or get injured or become unconscious, there's a way to alert people that they have that condition there. And something that probably goes more into the long-term management of patients with newly diagnosed Addison's would be requesting a bone density scan to assess for baseline fracture risk. These are patients that are going to have significantly increased fracture risk, and so more aggressive management of bone density is definitely indicated here. Having a look here, tricky? Yes. And this is, again, one of the challenges of these questions is often if the patient's in front of us, we know what we need to do, we do it. But putting that into words in an exam setting can be difficult, and so having these to practice on hopefully makes this easier for you. You've absolutely nailed it though in terms of urgent referral to endocrinology for advice on Addison's treatment, and you've gone into kind of more direct management of the patient, which I'll be honest is not incorrect. And I think if you were to put insert IV cannula, talk about rehydration, I think actually you'd probably get marks. And this is something, again, I'll highlight. It's actual doctors marking these exams. It's your peers marking these exams. And as much as they try and screen these exams, screen these questions, situations exactly like this come up every single year. And so if enough people have kind of done this same thing, where you've kind of said, oh, well, this could be interpreted in perhaps a different way, they do actually go back, look at the answers provided, add new answers, and remark those that may have put down those similar kinds of answers as well. They then also reword the question to be more specific for use in subsequent exams or practice exams as well. So well done. Here, referral to endocrinologist for ongoing management, perfect. Referral to dietitian for high energy diet, high protein diet, yes, very, very good. Not on the list, but definitely would get you marks here. Testing for celiac disease, yes, there is also a very big association between Addison's disease and celiac disease. So again, getting good marks here. Advised to stand up slowly. Potentially. I think it's probably a risky question. Risky answer. I don't know if you would get marks, truth be told. Flu vaccination. This is one of those tricky ones because is a vaccination classed as pharmacological or non-pharmacological? Arguments can and have been made either way. Personally, I'd probably give you a mark. But it would probably be one that some people may not consider. They may say that's a pharmacological intervention and so may not. And so if you can think of other answers, I'd probably use those preferentially. Hopefully that makes sense.